do want to get to our main presentation today. This work is what we'll tell you about it, but it's a project that it's quite large project that we've been working on for a couple years now. The title of the talk is Feeding Change, Advancing Health through Food Access in Kansas City through Policies, Environments, and Systems. We've got a whole bunch of speakers. We're also going to have a panel discussion at the end. Most of this work is funded through a grant that we received through the Centers for Disease Control and Prevention. We are 2.5 years into the REACH project, so we're about halfway through this 5-year project. And the project is quite large. You've probably heard us talk about some other aspects of the project previously. There are 3 what we call pillars. The first is Family Healthy Weight Program that is led by Children's Mercy and Swope Health. There is also a physical activity pillar, which is led by UMKC and Bike Walk KC. We've mentioned these at previous quarterly meetings before. The topic that we're going to talk about today is the nutrition pillar. And the nutrition pillar is probably the most expansive of all 3 pillars. There are a whole bunch of partners involved. There's a whole bunch of strategies and work plans that are in place for the nutrition pillar. So the lead investigator for the nutrition pillar is Dr. Kelsey Gardner. So she was going to be here talking right now, except luckily she had a baby, Maxine, last week. Came a few weeks early, but both mother and child and sister and father are all doing well. So we're very happy for Dr. Gardner. But she's been really kind of leading this work alongside her community partners. So you're going to meet most of the community partners today as we go through this work. As I mentioned, there are a whole host of community partners involved in the entire CDC project. Just for the nutrition pillar, there is the Mid-America Regional Council, University Health, MU Extension, Canby's Market, Cultivate KC, St. Luke's, UMKC, and Children's Mercy Hospital. There are 3 overarching goals within this nutrition pillar, and we're going to go through all 3 of those today through our presentations. The 3 strategy goals are produce prescription, which is really kind of it's one of those things is I'm not a nutrition person by my training, so I've really struggled with this one because there are a whole bunch of variations of produce prescription that we're going to learn about today that fall under this particular strategy goal. There are the second goal is food service guidelines, and the third goal is the food voucher program. So we're going to come back to this slide several times throughout the presentation, but we'll start out talking about produce prescription, and there's going to be 2 components to this strategy that we're going to talk about today. The first is a landscape review around produce prescription programs, and then we're going to learn, after that's done, then we're going to learn about one of the specific programs that involves produce prescription. So to talk about produce prescription, we're going to start off with the Food as Medicine Landscape Review. And Sarah Obermeyer from University of Kansas School of Medicine, project manager there, is going to lead this part of the discussion. Sarah is joining us virtually. So Sarah, feel free to share your screen.
My leg feels so weird. The needling.
Like I said, we're doing a lot of kind of complex technical things. So bear with us for a second. while she's getting that set up.
Hopefully that should be working okay. I'm sorry if I interrupted you, Robin.
Yeah, no, great. Thanks, Sarah. Feel free to share your screen. We're not seeing it now. While you guys continue to work on it. So Sarah is, we have a full essentially external evaluation team for the CDC project. And Sarah is part of that team. And so they help us out with evaluating the outcomes from the program and help us out with specific targeted individual examinations like these landscape reviews. So we've done landscape reviews for several different parts of the REACH project. And she's going to talk specifically about the food as medicine landscape assessment. So go ahead, Sarah. We can see you and we can see your slides.
Awesome. That's great. Well, as mentioned, we're missing Dr. Gardner today. This is truly her brainchild. She saw it through from beginning to end, and I assisted with the interview portion. I have my notes here. I'm a little old school because I don't necessarily trust this technology. We've got a lot of, as mentioned, there's a lot of complex things going on. But so if you see me looking down a lot, I got my notes here. Uh, Anyway, without further ado, this is a collaborative project. We have all of the folks who helped us out here named, and it's been a joy to move this forward. This is part of the REACH project, as we mentioned. Let's see if I can advance slide. Okay, it looks like I can. Awesome. The REACH project from the CDC, you've already heard a little bit about the grant and its goals. The food as medicine landscape interviews fulfill the requirement of the evaluation to have a landscape interview or a landscape review overall for the area. And it's also an opportunity to explore and connect with the people who are doing this kind of work in Kansas City, Missouri. And it fits in with this broader comprehensive approach, as mentioned, with physical activity, family healthy weight program. So a little note about food insecurity versus nutrition insecurity. This is something that's new to me, as I'm not steeped in this kind of research like Dr. Gardner is, but I thought it was really interesting, so I wanted to highlight it. The idea that food insecurity is limited access to nutritious food and it's associated with multiple chronic conditions such as hypertension, diabetes, and obesity. However, nutrition security would be the consistent access, availability, and affordability of food and beverages that promote well-being. So this could be connected to a chronic illness. This could be something that food as medicine can easily address by connecting the clients and or patients with food access, specifically the kinds of food that are designed to prevent, manage, or treat diet-related chronic diseases. And when we talk about food as medicine, this is the modified pyramid that Dr. Gardner's research team came up with. And it contains 5 broad categories, each with varied implementation strategies and potential outcomes. Going from top to bottom, we have interventions going from medically tailored meals, which is incredibly specific and for a specific population or a specific chronic disease type. And then going to the bottom, we're finding that we've got sort of a reduction of this specificity and they're less individualized and the inclusion criteria becomes a little bit less specific. And the interventions reach more people in the community. So we've got this broadening. So we go from medically tailored meals to medically tailored meal packages and groceries, produce prescription programs, to federally funded meal programs, to the population level food policies and programs, which can reach whole communities at once. So the purpose of the current study is to kind of meet all of the folks who are doing this in Kansas City, Missouri, develop a pilot coding scheme to put them somewhere on this pyramid to figure out, all right, what kind of work are you doing? and then identify some common characteristics of these programs as they're being implemented in Kansas City, Missouri. Sorry if you can hear me turning pages. Uh, we did a survey and in-depth interviews, starting with some of our more familiar faces and then asking for recommendations for others who are that who we might not have known before who are doing this kind of work in Kansas City, Missouri. And we were able to gather information about 11 specific programs. And we started with a survey and then we moved to in-depth interviews, and I'll describe each of these. The survey was 19 items. We sent it out online. It was through Qualtrics. We had several questions focused on kind of like probing where they would be on this food as medicine pyramid. And we also asked about like how our participants selected, how they received the food. We asked them to list their partners and what the roles of those partners were, so we could get a good idea of like what the network looked like. With the interview, we actually started with the folks who responded to the survey. And it was a few months later, and we asked for more in-depth description of each program. We started with about 10 people, and we were able to kind of snowball sample out to 7 additional interviews based on recommendations from people who are already doing the work and are engaged in it. And this included like folks who were we already knew a little bit about how a program functioned, but we wanted to know more about like, okay, so you say you work with a local food hub. Let's interview them. What is their take on how this work is going? So we got several different perspectives and a very rich approach to this topic area. And then we had them self-select their level on the pyramid and have a more detailed description of what they're doing, describing some of their facilitators and barriers, like what makes it easier for you to do this work, what makes it harder, and then sustainability and expansion. Like, what are your thoughts for the future? Are you going to plan more sites or have more partners, or like what can be done to scale this work if that's part of your goals? And so we part of Dr. Kelsey Gardner's team, part of their goals was to pilot this coding scheme for food as medicine programs based on this pyramid. And so they had 4 key questions embedded in the survey and the interview. So we're asking kind of some key information that would help them classify. And they had 2 independent coders survey for the survey and the interview to help kind of determine if these 4 questions could place someone on the pyramid. And then it was validated by just asking the interview participants directly what they thought, just to make sure that this wasn't something we were coding someone into. This was also something that folks were able to see themselves in. And so we've got some results. The eligible participants are usually screened into the food as medicine programs, most commonly screened for food insecurity, and that is standardized screening in clinic. And then when they were screened for chronic disease diagnosis, type 2 diabetes was always included. And this could have also been among other chronic diseases like cardiovascular disease. And collaboration was also very, very key for this kind of work. Everyone needed partners. And I mean, it's obvious why. The food system is very complicated, and getting food to folks while it's fresh and while it's still useful to them is just, it's complicated work. So you need a lot of collaboration. A few organizations focused on providing 100% locally sourced food, which has benefits for the local food system as well. And that was an interesting avenue that we kind of want to learn more about. All right, some of the organizational roles of the folks we interviewed were these leadership and oversight roles, comprehensive site partners, and evaluators. And of course, there were also food suppliers and funders who were also represented. geographic reach, these programs tended to have a pretty broad reach. So we have our this little cutout that I created of the 10 focus zip codes for the REACH project. We asked specifically about these zip codes just because that's where our project is focused. But like 73% of folks reporting said that they served people in each one of these zip codes. So that's pretty broad reach. And many also reported going on the Kansas side, which is fabulous. And any kind of follow-up study would absolutely include Kansas side as well. But that wasn't our focus on this particular landscape review. The populations served were primarily underserved neighborhoods and minority groups. And a few of the programs had either like parallel Spanish and English programming, or they focused just on Hispanic and Latino folks, specifically Spanish speakers. So that was really nice to learn. And then with the actual pyramid coding scheme results, they were interesting. The top most specialized programs at the very peak of the pyramid saw less representation, but moving on down, there are more produce prescription programs and population level food policies and programs, which reach these broader populations in the community. So the focus is really on getting the food to the people. Some of these interview themes, I'm going to dwell a little bit on this because I was a part of the interviews. We have facilitators for making this work go, and like what is going to make it easier to actually have a food as medicine program that is successful. The specific facilitators were more commonly described in the interviews. These were included relying on collaborative multi-sector partnerships, maintaining participant satisfaction and engagement through great incentives. So this could be the food itself, like the quality of it, how it's culturally tailored to the folks involved. And it's also the connections that the participants were encouraged to make, not only with the like program administrators and the educational aspect of many of these programs, but also, and like food coaches, nutrition coaches, but also with each other. So that was interesting, like folks swapping recipes with each other and making connections that making recommendations to each other, because food is very social. And the outcome tracking also was able to show some positive outcomes like A1C levels, improvements in health behaviors like diet quality and food security, and also was able to show that the program is working and needs to continue, which is always fabulous to build that evidence base. Some of the barriers were high needs of the participants. And some of these programs were specifically designed to address these particular needs, but there were still some gaps, it sounded like. And many of these are systemic issues like transportation barriers, physical limitations due to illness, childcare needs, a few language barriers. But we've already covered how some programs were specifically designed for Spanish, but there are more languages than Spanish that would possibly have folks with chronic disease who would need this kind of intervention. There's limited staff capacity. This is due to some of these programs being volunteer run entirely. Like maybe there was one staff person who's at the lead, but there may be like daily challenges of just getting enough staff in to run it. And then some have challenges collecting outcome measures, just getting the necessary follow-up to make those outcome measures solid. And lastly, it can be challenging to integrate with the healthcare and reimbursement systems and comply with patient privacy HR systems, which can all be very different, and then getting reimbursed by Medicare and Medicaid. So some of the amazing interview themes for sustainability and future plans. We need supportive organizational policies, new positions, resource allocation, funding, embedding these food as medicine practices. So getting the screening protocols smooth and seamless EHR workflows. Getting those in place can be very challenging. Strengthening community coalitions to support policy change. Compiling and disseminating program evaluation findings. Many folks are in the stage where they are about to report out, which is really exciting. Securing this long-term funding, including reimbursement from insurance, and expanding programs with new partnerships, additional sites, and increased capacity for evaluation and monitoring. So to recap, the programs are focused on the sort of lower, broader part of the pyramid that reaches more people. Diabetes was the most targeted condition of all of the health conditions targeted. And the pyramid coding piloted in the study can improve comparability and the kind of standardizing the language we use when we're talking about these policies, so that we can improve advocacy for these kinds of policies. A few limitations. We do need further outside validation of the coding scheme, so the sample should be expanded. And it, like I mentioned, we're go to the Kansas side, get even more regional. And then if it's possible, we could have possibly, sorry, missed some programs due to just like defining and pinning them down. Like, is this food as medicine? Do you consider yourself food as medicine? Even if you're on the pyramid, you may or may not consider your work food as medicine. So there are a few implications for practice. The pyramid coding provides a useful tool for others conducting landscape interviews, but there are many opportunities for harmonizing systems to improve program evaluation and data collection, and referral pathways, and reaching for these policy changes to help scale these interventions. One person did mention in an interview that their program is currently aligned with like Make America Healthy Again thinking, and that this should be helpful to them in any kind of policy advocacy situation. And for new programs to translate what we already know about medically tailored meals into community implementation so we can get a little bit more representation at the top of that pyramid for folks with a lot of need. So this is my concluding slide here. There are no more. These are my big takeaways. We've got our landscape interview, concentrate on lower part of the pyramid. We've got huge strengths in collaboration, although we still have some systemic barriers. And hopefully this landscape review will help others talk about food as medicine in the future, give us a good idea of what's here, where we need to go, and give people an opportunity to think about scaling and policy advocacy. So I'm able to take some questions. I'm not Dr. Gardner, but I'm happy to answer what I can.
Yeah. Thank you, Sarah, so much. Great presentation. We will open it up to questions. Does anyone have questions either in the room or online? And maybe I'll start out. You collected a lot of data. Will the findings be disseminated beyond just like what you're doing here today?
Absolutely. We have a manuscript in the works and a few other planned presentations. Ooh, let's escape through that so I can actually see everybody. There we go.
Any questions from anyone? I've got another couple. So the pyramid, would you expect the programs to be distributed on that pyramid in like a relatively uniform way? Or, it kind of sounds like, or it appeared that, you had a lot of people at one level, a lot of programs at another level and then nothing in a few levels? Is that, what would you expect that distribution to be in a healthy functioning system?
That is such a great question. I don't know if I would expect it to be like fully like even throughout. That would um because it is so focused on the community. And I think that there are some situations like the federally funded meals level where they're not thinking that necessarily they are doing food as medicine, but although that is like targeted meals and nutrition for specific populations, so I can see how those um, the levels that didn't have as much representation, I can kind of form my own theories as to why. At the very top of the pyramid, the medically tailored meals, my theory is that some of that is still sort of in its like initial research stage, like we're figuring out what kind of medically tailored meals work. But I think that there are great opportunities to translate that into community practice. And uh, having these other programs that already are um, giving food vouchers or um, advocating for policies that are more inclusive, that those could form a good model for where to go next, if that makes any sense.
Yeah. Yeah.
With some of the research that you did you have to kind of decipher? Because I know, and I don't want to get on a topic of like the GLPs and things like that, but did you have to take away any of the research because some of those medically prescribed programs are now not just food? They now have the prescription medicine or something. Did you have to, or did you run into that at all with any of the research?
We actually didn't see that,
Oh.
although it is interesting that that sort of intersection like would exist. I'm not sure how I would have handled it if I had run into the idea that like yes, we've got the what is it, the GLP ones and alongside so like a treatment for obesity or using it to manage diabetes.
Because I know a
Um,
lot of like not prescriptions, but insurances are providing that as like a combo deal now. Like, yeah, you can go see the nutritionist, but you're also going to get this. I just didn't know if you ran into that.
Not in the programs we were looking at, but I think if we redid this survey in a few years, that might actually be something we see more often.
Oh, yeah, go ahead.
Sandra Reese wanted to know if there are other studies being conducted regarding the food as medicine landscape at the state or federal levels.
I believe I've heard of something at the state level, but I cannot speak to it.
I can speak a lot to it, but
Please
I
speak to
know
it.
the state of Missouri has designed a similar survey that's totally based on Kelsey and this team survey that they're implementing statewide to do a food as medicine landscape review.
That is what I had heard, but I don't have any details, so I was a little bit reluctant to speak on it.
And nothing in Kansas that we know of, is that fair to say? Okay, we've got another question in the room. Go ahead.
Hi, Sarah. This is Heather Gibbs, Associate Professor at KU Medical Center. I think we've met. But I was curious if you could talk about kind of piggybacking off of that one question, if the proportion of programs, as you showed on the pyramid, is similar to what we're seeing nationally. And then maybe related to that is what were the date ranges of the interviews that you collected? Because I think there probably are more medically tailored meal programs now today with some of the federal funding calls that and local calls that have been more recent.
We ended in, I believe, I don't think we went into September at all. So we wrapped up in August.
That's pretty recent.
Yeah, it's pretty recent, but it still is like again, we could have missed some that were like maybe not in our orbit. Because we did do snowball sampling, so we were asking folks, as I may be familiar, we asked folks like, hey, who would you recommend? Who else is doing this work that I should really talk to? So that helped us kind of expand the networks we were working with. But if there is something that's unconnected, we probably would have missed that. So that's why it's important to keep looking.
Maybe I've got one final question, and maybe this will be a good take home message. You mentioned that just in your review, you identified 11 programs, and collaboration was a key strength of those 11 programs. So is there an entity that serves as like a central resource for these programs, that if someone wants to get involved with this type of work, that they can reach out to? Or what's the best way for others to, if they're interested in this work, to get connected with these other programs? Or are you able to answer that with your?
I think that was expressed as a need. And also there are coalitions. People are involved in sharing information with other programs. But I don't know that there's like all 11 did not report the same like centralized system that would help them organize and talk to each other. So that I think would be a need moving forward.
Okay, great. Thank you so much, Sarah. Everyone, let's do a standing applause. Go ahead and stand up, stretch your legs real quick. Give her an applause. Here, everyone.
Thank you, everyone.
Great. So now we are going to learn a little bit more about one of those 11 programs. And so to do so, we've got Janet Roan, who will be joining us. She's the Director of Community Health Strategies at University Health. She's going to give you a better understanding of how this particular produce prescription plan operates. Her program is called the Food Pharmacy, and it's spelled uniquely. You'll see that in a second. And she'll also include a couple calls of action for the produce prescription strategy of the REACH project in year 3. So,
Good morning. How y'all doing? How many people, so let me ask this has nothing to do with nothing that we're talking about, but how many people are still Chiefs fans, die hard, we in it regardless? Show of hands, please. Thank you. Okay, all right. Yeah, we got a rough year, but you know, hey, it's all in entertainment. That's exactly what it is, you know, where now this is what we're talking about now is a lot more serious. And so happy to introduce, and this is just a very quick snapshot because we have so many other speakers coming of food pharmacy, the food pharmacy initiative. And again, yes, I'm Janet and work with University Health. I've been there for quite some time. Kudos to University Health for having a lot of preventive services outside in the community. We always say we like to consider ourselves, you know, we go outside of the 4 walls of the hospital and we go into the community. As I look around and see people I know that, you know, I've been blessed to work with, Tila from way back when, you know, just being able to provide those services to the community. So the Food Pharmacy Initiative is one of the initiatives that we just recently completed phase 1 at University Health, and we were funded by the Health Forward Foundation, of course, University Health, as well as BioNexus, and maybe a few other little ones, but that's how we received the funding to be able to do this year-long pilot initiative. Oh, yeah, help me out. I got you. Thank you. Okay. And so our Food Pharmacy Initiative 12-month was a 12-month prescription intervention in collaboration with community partners to increase vegetable and fruit consumption among individuals with food insecurity and living with a chronic disease. And so you've seen this already, so and you already have an idea, know what it is. But we fall somewhere about right in between the nutritious food referrals and the healthy food programs. That's kind of where food pharmacy falls, in between there. Okay, so our targeted audience were those who were food insecure and diagnosed with a chronic disease. So you had to be both food insecure and have a chronic disease diagnosis to be a participant in our initiative. And to just give you an idea of what some of those illnesses were, high-risk pregnancy, prediabetes, type 2 diabetes, chronic kidney disease, HIV. I always say high cholesterol because I'll mess up that other word right there by it. So high cholesterol, health, heart disease, high blood pressure, obesity, and mental health. So any of these, along with food insecurity, qualified you to be in the program. Our objectives, of course, would be to increase fruit and vegetable consumption and to increase access to fresh fruits and vegetables and to empower individuals to make healthy food choices. And so that one for me was, that one was a little bit different simply because, yeah, you know, so we can certainly increase access to it by giving them because they received produce bags, fresh bags of fruits and vegetables bi-weekly for a whole year, you know, and so it was easy to promote health food consumption because we were giving them, you know, the food, and along with that, they also received a whole 12-month binder of health education, right? But that empower individuals to make healthy choices. So it's like, well, how do you do that? You know, and so you can give them the tools, but if you don't have, you know, that extra layer of support. So we had food pharmacy coaches who were trained to be able, and they already had a relationship, you know, so we partnered with Nurture KC. We partner with behavioral health, you know, we partner with Guadalupe Center, and all of these were their participants. They knew who to screen for to see who, you know, like on my caseload, you know, there are about 4 that I know should qualify for food pharmacy. And so they already had those relationships, which made it a little bit easier, you know, for them because it was someone that they trust, right? To be able to help encourage them to have a healthier lifestyle. So the outcomes, reduction of household food and nutrition insecurity, increase consumption of fruits and vegetables, improved nutrition and health literacy, improved health outcomes, sustainable lifestyle change. So now that we're at the end of our first phase of food pharmacy, we're able to, so we're still in the process of combining and doing that evaluation. One of our main partners, UMKC, they take care of all of that research and evaluation piece. Thank God for them. Yeah. So with that, but we're already able to see, because of some of the data that we have collected, that, you know, there has been a, you know, reduction in food and nutrition insecurity. You know, there have been an increase in fruit and vegetable consumption, you know, when we jump down to sustainable lifestyle change. Well, how do you measure that? You know, like, is it really, you know? So all we can really do is at the end of our initiative, we have focus groups. So we have focus groups for our food pharmacy coaches, and then we have focus groups for the participants. And so based on the information that was given, you know, we learned so much. We learned what was working well and we didn't need to change. And we also learned about things that we do need to change and we do need to improve upon, so that's, I would say that would be the best way for us to really, and then let me add, also, with, the collection of high blood pressure. I think we collected A1C and things of that nature. So to look at some of those numbers and see how those maybe had changed at the end as well. Is that it? Lessons learned. I probably already talked about some of this, but lessons. So again, some of the things that we've learned is the importance of the trained coach model. And that's our food pharmacy coaches, and we would meet with them quarterly. And so that was an opportunity because it was a pilot initiative, we were able to edit and make changes as we go, and so we were able to meet with them, educate them. And so to have that, I think was crucial. And what we are learning is that was a 12-month initiative. So that a lot of the people that we work with, they have many social drivers of health, right? And so with that comes, the inability to keep appointments, and they moved and the phone is off and all of that, right? So what I know, and so I think they're still collecting all that data, but I truly believe we're going to learn that having it for 6 months, the retention rate is going to be much greater than stretching it out for a whole year. A year's a long time. That's a long commitment, even for us, so, is that it? Did I go over all the others? Okay, I'm good. All right. Okay. Support steps forward, and that's support the infrastructure for 3 produce prescription programs in KC. That would be the KC Fresh RX Food Pharmacy and St. Luke's Produce Voucher Initiative, which you'll hear a little bit more about some of those. Engage in local conversations with multi-sector partners to drive FIM policies and practice changes in KC across the state. And we're seeking interested clinics to expand the Fresh RX program in 2026, which you'll hear a little bit more about. And so I'm assuming that we're going to save the questions for the,
So Janet will be on our panel at the conclusion of the talks, but if there's a couple quick questions that you have right now, I think we can answer a couple real quick.
Question. So logistically, what does that look like, getting those bags of produce to your community members? Are they like coming on site, or you guys delivering? Or what?
Okay, so we delivered. We have the Healthy Harvest Mobile Market, which at one point was used, it was like a grocery store on wheels back when we were actually going out selling fresh produce, but now, things have changed since COVID. And so now we use that mobile market to still, a lot of those bags are being made right there on the mobile market. And then we have a driver. And so we deliver those bags to each of our partners, and then they do the distribution of it. Only easy questions like that, please.
Something came with Johnson County K-State Extension. For your produce, did you source local produce when it was in season, or you primarily just did like grocery stores and stuff like that?
Oh, no, we went through a local vendor, here, and CNC Produce, and we always, would purchase as much local produce as possible, to support our farmers for number one, and it's healthier. Doesn't have to travel as far. Now, sometimes cost-wise, it could get a bit expensive, but yes, we always did that, and so, and for some of those, like now, you don't have as much, of course, in season. So we, our produce choices are tailored to fit the clientele that we're serving. So if it's Hispanic, it's going to be some of those choices. One of the things that, we learn is that, it doesn't make sense to give someone something that they're not going to eat, right? So we wanted to make sure that the produce was tailored to fit the needs of the clientele, but also introduce them to something different, give them what they want. And then in there's something a little bit different for them to try and see what they like, if they like it.
Coaches, what are their backgrounds?
Good question. That's a great question. So, there is no, we just wanted healthcare professionals. So some were community health workers, right? Some were, healthcare navigators, mental health advocates, I would say, just to give you some idea of what that looks like. And so we also, with the binder that they received, with all of the education in it, we wanted to make sure that it was an easy read. You know, you didn't have to have a master's degree to understand it. You know, you, with the experience needed, even for the participants, you know, let's just say, because we gave a lot of reference pages in there. We wanted to be, you know, like on a fifth grade level, fourth grade level, to where they could digest it and understand it. Is that it? Yay,
now.
you guys are so cool. Thank
For
you.
now. Great, thank you. Good, stand up, stretch your legs, get those blood moving. And then- Yeah. All right, so, now we're gonna have Melissa Cotton. She's gonna talk about the food service guidelines. And so this is the second strategy goal for the nutrition pillar. Like I said at the top, the nutrition pillar is doing a lot of work. They could have, the produce prescription is a project, a whole 5 years worth of projects, in my opinion, but they decided to do 2 other goals as well. So food service guidelines is their second strategy goal. Melissa Cotton is going to speak to us today. She is the field specialist in nutrition and health education for MU Extension. She's leading the food service guideline projects, and she's working with the community partners, which she's going to talk about, which include things like Boys and Girls Club and Casey Mill Parks and Rec. So welcome, Melissa.
Thank you. Hi, everyone. All right, so I don't know where to start, but I'll start here. So MU Extension, a big part of my job is to provide research-based education. And generally I do that in programs that I teach out in community settings. So cooking classes, exercise classes, things of that nature. So very much targeting individuals, like teaching what do we need to do to be healthy? How do we do that? And I really love policy systems and environmental work like what we're talking about today, because it's a perfect pairing with individual level education. So if I go out and I teach someone what types of food make up a healthy diet and maybe how to prepare those foods, but if they go out into the community and they can't access them, what good is that knowledge really going to do them, right? And so this type of work helps us to build those community supports so that people can now have the knowledge and the tools and the access to live their healthiest life. So Eat Smart in Parks is the program that was selected to carry out the food service guidelines implementation in the Kansas City area. And so this program was created by the University of Missouri, and it's really about going out to organizations and that sell food in public places, so parks, pools, that sort of thing, and just making sure that healthy options are included on the menu. I know sometimes, and I can say this because I don't live in Kansas City, I live a little outside of it, and so sometimes you go to a public place and you look at the menu with your kids and you're like, oh boy, there's just nothing there to choose really. And so we want to make sure that we have those options when we're out and about in the community. With this work, I've been able to work with 2 really awesome, and I'm not just saying that because you're in the crowd, but really 2 really awesome dynamic organizations, Kansas City, Missouri Parks and Rec, TILA is right here, and the Kansas City Boys and Girls Club, we have Wayman and Darien. And they're all doing such fun, important, amazing work in our community. And so it was great for me to have the honor of working with them. Thank you for being open and just willing to hear us out and engage with us. And through that, we've already had several wins and our work continues on. So years 1 and 2, a lot of this type of work takes so much time because you have to build relationships, you have to build trust. When you have this random person come in and saying, hey, can we look at your menu? Can I assess the nutrition of what you're selling? You know, you have to have some trust and buy-in with that. And so kind of the biggest thing that we tackled was, you all are already doing really fantastic things. How can we take that and build upon it? And sort of the first key piece was to assess what's already being sold and how does that look in comparison to the food service guidelines, those standards for healthy items. And so we did that, have a nice tool. If you use that QR code, this takes you to a toolkit for the Eat Smart in Parks program. Everyone has access to that. Of course, with anything of this nature, there's no one size fits all, but there's some really nice steps to going about this if you too were interested in this sort of thing. So I went and assessed all the items in the concession stands and the vending machine and developed this report that then I presented to the organizations of here's where we're doing really well, here's where we have some room for improvement. From that, at a couple of our community center sites, Southeast and Mary Williams Neal, we created signage that goes right by the vending machine so that when consumers go to make their choice, maybe after their workout or at halftime of the basketball game, they can make an informed decision. Oftentimes you put your money in there and you can't see the nutrition facts until it's already in your hand, right? So that gives you a little bit more information on the front side. So that was one cool win early on. And then now we're sort of in this stage, since we've assessed what's already happening, we want to get community buy-in and we want their input because before we change anything on the menu, we want to know what will be successful. So with the help of UMKC interns, thank you if anyone's listening or in the room, thank you so much. I could not do this without you. We've been going to some events at the Parks and Recreation sites and surveying the patrons and saying, what do you think about this? Would you like healthy items? What kind of things would you be likely to buy? And we're building that database so that when we do implement those healthy items, we're pretty sure that we're going to be successful. And sort of the next stage of that is also doing some sampling. We've started. I see Jimmy from Canby's Market has provided us samples, some what do I want to say, smoothie pouches to see if that would be a great item. That's handy for the concession stand itself because it's pretty shelf stable and then also very convenient to eat as you're on the run to the next event. So a couple of small, big, they're not small, they're big. They're all good wins along the way. Okay, so we're doing the surveying at the Parks and Rec, and then we're also going to be transitioning to Boys and Girls Club and doing some of that same surveying, sampling along with this. We're also providing education. Why is this important? Even at the individual level, we want them to understand what we're doing, why it's important, and how that they can take this into their own life and just carry it forward. I feel like I went to the wrong page. Nope, this is right. Okay, so we'll continue doing that. Then the next step really is to look at policy. So it's kind of not the most exciting thing of PSE work, honestly, but it's probably the most important. So as you can see, we're in year 3 of this work and it's still ongoing. So the thing that we don't want to happen is that as we have transition in organizations, which is just going to happen, that all of that work just sort of disappears with changes in personnel. Policy kind of ties that in. It creates that sustainability piece that change can carry forward no matter who's at the table. So that's sort of the next step. And the cool thing about Eat Smart in Parks is if you do it right, any PSE work, if you do it right, then you shouldn't have to keep coming back and changing all the time. Definitely you can, but it should be pretty able to stand on its own. And so that's sort of what we are working towards. So with that, sort of our call of action is, if you know of parks or community centers that might be interested outside of the 2 organizations that we're already working with, please help us spread the word. We'd love to bring these healthy options to all areas of our community. So I think that's it for me. Any questions?
Yeah, we can take Melissa will be on our panel at the end, but we can open it up for a couple quick questions if you have any.
Yeah.
When you mentioned policy, and I agree that that's how you make, long-term impact. Right?
Yes.
You look at situations of the current staff, et cetera. Regarding policy, where does that land? Is that within a particular park department, or is it citywide, or could it be countywide or something like that?
I think it can look a lot of different ways, and it's really up to the organization. So I'm not coming in and saying like, this is what your policy has to be. I hope you haven't felt that. We want the organization to have full reign over that. And we want it to be realistic because again, the goal is for it to be sustainable. So it could be site by site, potentially, it could be by organization, and so on and so forth. It really, that would be a great question actually for Tila or Waymond of what that would look like. It probably depends on their organizational structure.
Thank you.
Yeah.
Any other quick questions? So just as a reminder, if you're partnering with these great organizations as part of the REACH project, but anyone can take advantage of the same food, Eat Smart and Parks curriculum, correct?
Absolutely,
Like
yes.
that QR code you should.
Yeah, absolutely. It's there. It's free for anyone to use. And if you need any support, that's what I'm here for. So just kind of nice to have a person along with what you're reading. So okay. Thanks.
Excellent. Thanks, Melissa. Yeah, stand up. You know the drill. Stand up. All right, so that's strategy 2 of the nutrition pillar. Strategy 3 of the nutrition pillar is the food voucher program. And so to help us walk through all that's happening with the food voucher program for the CDC program is Jimmy Izek he's the Senior Director of Operations at Canby's Market. He's been involved with this, and this is, I think he's going to talk a lot about it. This is a unique collaboration within the project with both Canby's and Mid-America Regional Council. So take it over, Jimmy. Just use the arrows.
Very good. Thank you. Good morning. Like I said, I'm Jimmy Itzek. I'm the Senior Director of Operations at Canby's Markets. And to give you the briefest of introductions, we're a nonprofit that works locally to provide food access across the Kansas City metro. We also do a lot in food rescue, which also helps some of our other projects as far as getting food to food pantries and other kind of social service providers. This project has been very unique, and I've been privileged to work alongside Donna Martin, who's the project director for the Double Up Food Bucks program at Mid-America Regional Council, as well as the Fresh RX. I hope I said that correctly. I saw Donna on the call here, so hopefully she'll be able to fill in any gaps that I might have in my explanation here. But we had a vision to talk about Double Up Food Bucks. And at the risk of insulting your education, I just want to explain Double Up Food Bucks in the briefest possible sense. This has been a program that I've learned a lot about over the last couple of years. Double Up Food Bucks is a program that is available to SNAP EBT users. It is exclusively for fruits and vegetables, and retail locations have to be approved and funded specifically for for SNAP users to be able to redeem that. There's a couple of different models. It's available at farmers markets. There's a loyalty card program where you can get awarded points that you then redeem later. There's a 50% discount model. There's a number of different ways that SNAP users can take advantage of this model. But we found that Canby's is in a unique situation where we have quite a broad network. We have 112 locations today that we are selling fresh fruits and vegetables at an affordable rate. Our goal is to beat Walmart and Aldi if we can possibly do that. But we are across the Kansas City metro. We pioneered into Kansas earlier this summer and have 12 locations that are operating there already. But we've primarily targeted areas that are classified by the USDA as low income, low access, or food deserts. And our goal is to provide that access within a half mile of every home in the city. We just believe that is a fundamental right that people should be able to have, is to find affordable, fresh produce within their local neighborhood. As we were exploring this option, and again, just me not knowing a lot about SNAP usage, the more we began to talk to some of our stores, the more I began to learn how many SNAP sales are being processed at these corner store locations. So to be clear, Canby's Markets is a kiosk of fresh produce that operates inside small businesses around town, primarily convenience stores, gas stations, liquor stores. The idea is that with 11-ish grocery stores kind of in the area east of Troost to cover about, we estimate about 106,000 people. We find that there are community locations, corner store locations all over the place. And so by providing this, we are starting to address this idea of accessibility. And that's really what kind of spawned this collaboration is the big question, how could we provide Double Up Food Bucks closer to people and offer it in more locations? Right now, Double Up Food Bucks is being offered all over the region, but primarily in Kansas City through some of the larger retail establishments. It's a easy process. There's built-in loyalty card systems that are easy to reward points, redeem them later. But we wanted to talk about expanding that reach. If these corner store locations are processing this amount, hundreds of thousands of dollars of SNAP benefits, how could SNAP users take advantage of that? And just as an aside, Canby's really benefits from this because our mission is access. And one of the conversations we have ongoing is what does access mean? Is it just about where it is and offering it in a lot of locations? I think that's part of it. We encounter a lot of transportation insecurity, and we find out a lot of this information through our partnership with St. Luke's. We have patients that are enrolled in a program to utilize vouchers at Canby's locations, and we hear about transportation being a barrier to consistent access to fresh produce. But we've also started to talking about affordability. If it's right next door, but you can't pay for it, then it doesn't matter where it is. And so in thinking about trying to also address issues of affordability has really spawned this conversation about Double Up Food Bucks. If you can get 50% off produce with your SNAP benefits, all of a sudden what may not have been an option becomes an option. So what we've decided to do is we've begun to talk kind of from the Canby side of things with some of our store owners and ask them not only about, do you accept SNAP, but would you be interested in trying to figure out a solution to this and be able to offer this in your location. And we've been pleasantly surprised at their enthusiasm behind this. What we've encountered is the technology side of things has been the consistent barrier. Stores have the ability to process SNAP, and that is fully ingrained. And right now, Double Up Food Bucks relies on that prerequisite. You have to be able to already accept and approve SNAP. Double Up Food Bucks has a few extra requirements for reporting and for this idea of redemption. And so we've gone to the stores and say, at some point, you're going to have to adjust your point of sale system to be able to process Double Up Food Bucks in addition to your SNAP purchase. And we'll have to be separate to that. Oh, thank you. Yeah. And that has been a little bit of the big question mark. And it's what we've primarily spent our time doing over these first couple stages is addressing interest, but now actually addressing the feasibility of this. We have a store owner and a few stores that are willing to explore this with us. And we've had to work directly with the point of sale technology system. Most of our stores use the Verifone Topaz system, which I've learned a lot about in the last process. Some stores are able to program their own buttons. Some of them need the tech support from Verifone, but some of them are still trying to wrap their head around what needs to change to be able to reward and redeem these points, and then also provide the reporting necessary for Double Up Food Bucks for the reimbursement. So we have an idea, a prototype that we're trying to get installed. I was hoping to be able to make it over to the store yesterday and talk them through some of the obstacles that they've encountered. It's going to have to end up being tomorrow. So I'll have more information on that. But going into the new year, we have a strong belief that we can program this in. What has to happen is we need the system to be able to award a 50% discount that can be cataloged in a report submitted then for reimbursement. The concept, with as simple as I just described it, sounds easy. It's not that easy. And here's the other thing is as we go in, and I'll talk about this in our kind of year 3 and what we're going to, we want to create a blueprint that other stores can quickly use to be able to onboard with this, any eligible location to be able to do this. So what I need to be able to create though is if you do these things in this sequence, voila, make your application, talk with the Double Up Food Bucks team, figure out if you're eligible and how to get funding, and then do these 3 things to make your point of sale system usable. That's where we're going with this, but we do need a pilot. We're still a few steps before that where we want to pilot this, beta test it, troubleshoot it as we can to get it to work. The store owners have had obviously a number of questions. Does it cost me anything? Is it okay that we suggest a manipulation to your point of sale system, or would you allow us access to that? There's potentially some reticence. And one of the just cultural things that I'm learning is these stores change hands more frequently than you'd expect. They are bought and sold pretty regularly. I have a store right now that's been sold 3 times in the last 6 months. That means that I have to have that new conversation with those new owners. And if that store is approved, does the new owner then just inherit this? So there's also a little bit of logistics and contingency planning that we have to consider in the process. And then obviously when a new manager, a new clerk takes over, what does that training look like for them to be able to do this without any kind of loss in service, but also making sure we're still checking all of the boxes to make it feasible. So there are a few obstacles, again, mostly tech-based, but also some training accessibility that we want to address. But we do have some store locations that are on board, and I think once we see this work, we're going to see a blueprint, I believe, that is going to be very simple to expand into the region. So our 1 to 2 year goal was to just look at feasibility and interest. Again, progress. We do have stores, 3 viable locations. Since I posted this, that owner sold one of those stores. So as you can tell, these are kind of changing hands, but I still think that store will participate. There's still a solid relationship there. And then in the year 3, we really want to see this beta test in the early part of next year be successful so that we can begin, again, writing that blueprint. For our call to action, and again, this was a collaboration on how we can get support for this, and I'll summarize this for you. Once we get this adopted, we have to figure out how to tell people about it. The MARC team, the Double Up Food Bucks team, has signage, has explanations for how both the clerks can talk about this, what is acceptable and how they're going to be interacting with customers and informing them that this is a benefit available to them. How can we get signage on our coolers so that SNAP users know that this is Double Up Food Bucks eligible? But how do we then expand that adoption and get that word out? So supporting these stores that are going to start accepting this program, spreading the word about Double Up Food Bucks to SNAP shoppers, and continuing to get Double Up Food Bucks funded, especially with all of this SNAP stuff that just happened over this fall. There is a need, I think, more than ever for people to know that this is a reliable benefit for them as they are using their SNAP EBT benefits, that Double Up Food Bucks can only stretch that even further. And then advocating with legislators for new Kansas funding to expand into new locations as well. All right. What questions can I answer for you? Yeah, Janet?
But, kudos.
Thank you.
Compliment to you, Campus Market. Probably the best news I will hear all week is that you have expanded to KCK.
We have.
Congratulations on that.
Thank
And
you.
I think it's so needed there. Second thing is, I know you could talk about everything at Canby's Market too, but I just want to give you a shout out for, when you're dealing with fruits and vegetables, they don't last long. They go bad really quick and you have all type of imperfections and all of that. But to really decrease the food waste and the things that you go above and beyond to do, taking it to the zoo and doing, all the other things that you do with that. I think that that's remarkable.
Thank you.
Continue the great work that you're doing.
I appreciate that. Thank you.
What a great question. Just a compliment.
I know, right? Anything else?
Well, maybe I've got some questions, but first of all, just a comment maybe. I didn't mention this at the top, but as part of this CDC funding, it is funding through the REACH program. And the REACH program, I've forgotten how many different REACH awardees there are. I'm looking to Kelly, Natalie. There's something like 20, 25 REACH fundees, awardees across the country. And so we're a part of this network. And so if Jimmy gets this Verifone technical problem solved, this can be spread throughout the entire country. This will be beyond Kansas City. And when you think about that, think about the number of access sites that can be expanded for SNAP and double up food bucks across the country just by solving this technical glitch. It is truly amazing.
No pressure.
If I get this done, this really will be transformative for the food landscape in the entire country. So this is just truly amazing work. So great job. So with that, Jimmy, you can come back up to, now we're going to transition to our panel discussion. So we'll have Jimmy, of course, Janet come back up, Melissa come back up, Tila, we've got a new panelist we'd like to join. So Tila, come on up, and Donna Martin as well. So we're working on bringing, Donna's going to join us virtually, so we'll introduce her in just a second. But Tila Maxwell is a supervisor within the Kansas City, Missouri Parks and Rec Department. And she is one of, as Melissa talked about, one of the key partners in the Eat Smart in Parks program. Donna Martin is the Double Up Food Bucks and Fresh RX project director for the Mid-America Regional Council, who is working with Candies and Jimmy on the that strategy for the project. So we've got a nice mix of both community partners and kind of organizers here on our panel. And with this panel, we want to talk about, we want to answer any of your questions that you may have. And excuse me. And I've got some specific questions as well. So maybe, do we have Donna or oh, we've got to do something on our, give us just a second. There's Donna. Hi, Donna. Good to see you.
Hello. Can you all hear me?
Yes, we can, Donna. We can hear you and see you. Okay, so maybe I'll first start off and ask all the panelists kind of the big question that we haven't really talked about yet today. Increasing food access has gained a lot of attention in the past couple months because of all the things that have happened at the federal level. So maybe can we just talk about, and we'll kind of go one by one through the panel. Can you maybe talk about how any of these issues at the federal level have impacted your organization's specific work, and if there has been any increased need for food assistance, how you might have had to modify your approach in this kind of really challenging times, and then just anything else that you feel like you need to communicate out to other members of our both in-person and virtual audience. And maybe Melissa, we'll start with you.
Sure, thank you. So a few different things come to my mind. When the big beautiful bill passed, we lost SNAP Ed funding nationally, and that greatly affected extension nationwide. And so
What is SNAP Ed? Yeah.
SNAP Ed is education specifically for individuals who would qualify for SNAP. So often instructors would go into schools who had high populations of free and reduced lunches and who would fall in that SNAP qualification zone, sort of, and provide education specifically to those groups who have those populations. And so I want you to know that I feel like this is not totally working. Is it working?
Yeah.
Okay, that just sounds weird to me. Sorry. Yeah. Okay. Anyway, so even though we had to sort of transition organizationally and there were a lot of changes, we're still doing all that we can to provide that education. It may look a little different. We have a slightly different capacity, but that work continues on. So some things that we have done as food insecurity has become such an issue, like as the government was shut down and those benefits were trickling in. I know here in Kansas City, our team was really concerned about we need to help feed the families in our community. And so just as of late, we've been trying to kind of throw together some food distribution. So just last week, we had one in partnership with Truman Habitat and Independence, and we provided 200 boxes of food to the community there. I went to, Clay County Health Department. I was like, please help me. I have some money and I want to get food out to people. And they were so gracious and helped me to figure that out. So just to plug our upcoming distribution, that will be December 17th at 3 p.m. at the Clay County Health Center. And we're going to continue doing that as best we can. And also MU Extension has been doing this work even before this year. So one big project we focus on is the Senior Farmers Market Nutrition Program. And here in the Kansas City area, the last 5 years we've been involved with the program. We have given out over $150,000 to low-income seniors. And what's really cool about that program is it helps those seniors access local produce, and then it goes into the pockets of our local producers. That money comes from the federal government to the Missouri Department of Ag, and then we're contracted through them. And so those are just some of the things that came to my mind of ways that we're addressing and sort of shifting and trying to stay relevant.
In addition to what you just said, so our department, community health strategies was pretty much cut in half. So where we used to have nutrition and nourishment, we had community partners in prevention, which was kind of a tailor-made program to be able to go and, if there was an organization or agency that said, hey, I have a lot of my clientele, they're diabetic, can you bring in some education and some workshops? We were able to do all those things. And we just had an array of different community programs. Well, with the cuts and we have about half the staff now. Of course, we had to, really restructure. And so now our primary focus is like nutrition and nourishment. And so you just heard me talk about food pharmacy. We also have the Healthy Harvest Mobile Market, where we go to the schools, and we also focus on food insecurity, and we provide produce bags to about 4 different schools. And we depend on the social workers or whomever to do the screenings to determine which kids get it. Food is now, so we purchase this. We don't get anything donated. So this is all purchased produce that we receive fresh daily. It's higher, it costs more. And so that means that our dollars don't go as far, and so we've just had to, continue to restructure, but, where there's a will, there's a way, so then came, with food pharmacy, we were able to be funded in that manner. That's why I always say, hats off to University Health, because we still are able to provide those services to the schools and work on addressing food insecurity. But those are that's some of the impact that has happened with us.
Camby's is a distributor.
Yeah.
Impacts you too, so.
Yeah, and that's some of what I was going to speak to is we went into a crisis response mode when the government shut down for about 2 weeks. And one of the programs I didn't really speak to that Janet was so kind to draw attention to is really the other half of what Camby's does, which is our food rescue program. Food that would be going to landfills. We intercept to redirect this year. We've done about 1.5 million pounds that would otherwise have been wasted, and we sort it and send it to some other productive end. Typically about 63% of what we rescue is still fit for human consumption. It may not be pretty, but it is still healthy and usable. And a huge portion of that, about 56% of what we get, we donate back out to food pantries all over the city. We have about 53 we call them hunger relief partners that come pick up from us weekly. Typically, we are giving back out about 20,000 pounds of rescue food to these partners every week. Through the crisis response that we put together, we were able to give out about 50,000 pounds each of those weeks. So 100,000 pounds total in 2 weeks, which was a significant, about 2.5 times what we're used to seeing. And some of that was the additional food that we were able to intercept and that was we were able to get from our local wholesalers, and just telling them like, listen, people really need food right now. What can you do? And they were able to pull a little bit more and send it our way. And so we've got a lot of very good food over the course of that 2 weeks that was able to go back out to these partners all over the city. In addition, we had individual donors. We did a fundraising campaign, and we made about $18,000 worth of vouchers, $10 vouchers that could be distributed through our nonprofit network to people that they could take to our Healthy Corner stores and redeem them for fresh produce as well. And so we really went on, and I think our response just speaks to this is really something we hadn't done before, but knowing through this process what we can do and how we can mobilize this network was very encouraging, and we just have to believe that it really did make the difference while people were in such insecurity.
Tila, maybe just introduce yourself and tell what your specific role was in the Parks Department. And I'm guessing maybe you're more directly involved with some residents. You may interact with them more. Maybe what were some of the impacts you saw?
Yeah, I'm Tila Maxwell. I'm the supervisor of recreation. I'm a center director, so I oversee the Southeast Community Center on the hill on 63rd Street. Wayman is one of he beats me to the center if I ever have to open up at 6 a.m. He's waiting in the parking lot for me. We do a lot of collaboration work. That's kind of how I've known them. So in my previous work, I worked at the YMCA for years at Linwood, and I've worked with all these organizations. So it's very important to me that we reach the participants in both manners, their health and wellness with the gym, working out, fitness classes, but then their nutrition. So unfortunately, we had classes that had to get canceled. We had classes through Missouri Extension. We had classes through University Health that had to stop, and those were wonderful programs. So when it came to now, we don't provide resources. We just collaborate. That's kind of what a YMCA or parks, or even I'm assuming the Boys and Girls Club do. We provide a partnership in a space to provide their programming. So a lot of what I did when we found out, things are going to get cut is really trying to figure out who has the food, where the resources are. Can I get updated flyers? So the main person I reach out to, she's not in this room today, but Jessica Bentley with Urban Community Connection. She's the connector of all things in Kansas City for the most part. So figuring out where are your pantries at? How can I get information about them? It is staying up to date with all the information as possible. We're right next to Unity Southeast that does a mobile market or mobile pantry, and also the Cleveland Family YMCA does. So that's what we did. We made sure that our community table is up to date. We have the information. The front desk staff had packets of information to tell people when they were calling, because they do call us first. We are not only a community center, we're a city, funded community center. So they're calling us first saying, well, I need food. Can you guys help? On the side of that, people know me that you can donate anything to me. This is off the record, right? I will take anything at Southeast. I can't speak to any other center, but we had a donation come in a couple times in the last couple weeks, and we'll just kind of put it on Facebook and say, hey, we have food here, come and grab it. And so it's been really helpful to people that have actually, we are also a warming center. Don't know if you guys were familiar with that. We're a warming and a cooling center. So what happens is the participants that are utilizing the center, they can take that food, people that saw it on Facebook or whatever, and these are just like my personal page, right? They're coming to get it. And then our members get to take advantage of it as well. So we're trying to do the best we can in the predicament, well, but the position we're in, because we're still a municipal, right? So we don't really have a tie either way. We just want to be a resource center for the information. So I think that's what we've done. And I hope this, what we get to, and I think you might have some additional questions about this, but that's why this policy change is important, because we do have to have that policy in place so parks, within Kansas City can actually have some change or some affirmative, constructs around what we need to do and how we need to be a part of it.
Yeah, thanks. And Donna, last but not least, but maybe just introduce yourself and your role within Mark, and then of course you probably were, because Double Up Food Bucks is a federal program, I'm sure you'd like to share some of the impacts you had.
Sure, thanks. Man, seeing my face over all of you is a little unnerving. I feel a little bit like the wizard in the Wizard of Oz, but so yes, I'm Donna Martin. I work at Mid-America Regional Council, and I am the project director for both Double Up Food Bucks, which is statewide across Kansas and Missouri, and KC Fresh RX, which right now is really focused in the Kansas City area. Yes, so when the government shut down, first of all, we did from a Double Up Food Bucks perspective, we really tried to get the message out and tried to get all of our locations that are offering the program to their customers to really emphasize that people could still use Double Up Food Bucks if they had already earned it or had already received it from farmers markets. So just letting people know that even though, like in November, when they weren't receiving SNAP benefits for a while, we were really trying to get the word out that they could still use any Double Up Food Bucks that they had already received, which we were hoping would at least help a little bit in terms of stretching those food dollars, and also get them some healthy food, especially if they were, maybe getting a lot more of the shelf stable food by going to pantries and things like that. So we really wanted to help people understand their options and all the things that were available to them. We are concerned about SNAP. SNAP, we all of the wonderful programs that do emergency food assistance are amazing and awesome. My concern is that if we keep going down the road we are going, both federally and at the state level in Kansas and Missouri, that our emergency food organizations and programs are going to be overrun and not be able to meet the need. And I hate to be a downer, but that is a real concern I have. That's what keeps me awake at night. And so I have to acknowledge that, for every one meal that emergency assistance programs provide, SNAP can provide 9 meals for that same amount of resources. So we are, our policymakers are doing us a huge injustice by making these cuts to SNAP, which is a humongous, probably the most important policy and program that we have in this country to fight hunger. We all need to be building off of SNAP rather than cutting it down and bringing it down. So, so we are concerned about SNAP, and only time will tell what the impact of those cuts will have on Double Up Food Bucks Redeemed. So one of the things I would ask, if you are a person that actually, if you are at work with an organization or a program that works with people who might qualify for SNAP still, even in this environment, but who has not taken advantage of and applied for that program, I would say do everything you possibly can to get them on SNAP. I do know that it, especially on the Kansas side, there's a huge burden of filling out the form. But if all of our organizations can kind of step up and help people fill out those forms, get them on this program, that would be a huge help. Then we do need to worry about the people who are truly losing this benefit, and we can talk about that more as well. We are also concerned about our partners at MU Extension and K-State Extension. We could not do this program without those partners. And to Jimmy's point about how do we get the word out to SNAP folks, one of the things that we do rely on is the two departments on both sides of the state line. They help us get those messages out. They send some of our brochures and informational letter once a year. And actually, I know they're sending out more than that, because I know when there's a particular region that's receiving our brochures, because I'll start getting phone calls when Cape Girardeau will be getting a whole bunch of brochures out there. I'll get calls from that area, or it's some other area in Kansas. So the cuts that they've had to make in their staffing is also a concern. So the last thing I will say that I'm keeping an eye out on is the SNAP waivers that are happening. I know that's not federal, but they have to apply to the federal level for those SNAP waivers, and both Kansas and Missouri have done so. And so trying to keep an eye on what policies are actually being included in those changes of what foods are or are not eligible for SNAP anymore is one of the things I will be keeping an eye out on. And the reason why I am doing that is because those policy changes at the state level affect our grocers and affect our farmers market folks. So the more complicated we make things for those folks, it's a lot of burden on them. So I am concerned about that as well. So happy to converse more.
So I'll open up. Are there any questions either in the chat or in the audience for the panel? Feel free to ask them, otherwise you're going to get my questions. While people are thinking of their really good questions, maybe we'll talk to Tila just real quick. So why is it important for KCMO Parks and Rec to be involved in the Eat Smart in Parks program? How is that beneficial? You guys, you're a big organization. You have lots of people asking you to do things. But what is the value to you for your involvement?
I think you just said it. It's because we have such a big basis. We are Kansas City Parks and Rec, correct? So we have 10 community centers expanding all the way north and south throughout the region. And we built trust with people, right? So people have their baby showers there. They have their repasses there. They have the most intimate parts of their lives at the community center, on top of not only using it as a workout facility. Their kids are getting swim lessons there. Their children are in the Mayor's Night Hoops program. They're involved with our programming so much that it just makes sense that some of that reinforcement of healthy habits comes from us. In my time and just working in this industry, even at the YMCA, right? We end up being their therapists, their coaches, all of it. I've gotten calls through the years. Hey, Tila, what washer and dryer should I buy? Don't know how that happens, but they trusted me in my opinion. So it makes sense that we see these people all the time in every aspect of their life, every decision they have to make. So if they have to make a decision about being healthy, it should come from somebody that they see all the time. So it just makes sense for parks to be involved with that. And then hopefully we don't really have anything in place, but I hope this policy change or this work that we're doing to adopt a new policy will help out.
Thanks. Donna, maybe I'll ask you, in our produce prescription part of the presentation, we learned, we identified lots of produce prescription programs. We heard about food pharmacy through University Health. I know Mark also has a program. Do you want to just talk briefly about the program that you're involved with and what things you're looking for to expand that program?
Sure. Yeah, happy to do so. I'm super excited about our KC Fresh RX program. So our KC Fresh RX program really builds upon our relationships that we've made through Double Up Food Bucks in the Kansas City area. We also have built relationships with 4 clinics right now, and we're seeking to expand the number of clinics for 2026. And what happens is the clinics refer patients to us that have expressed experiencing food insecurity in the past year, who are either diabetic, pre-diabetic, and/or pre-hypertensive or hypertensive, and they are Medicaid patients. So they refer patients to us. We get them enrolled in a 6-month program, and the program consists of 2 different things. It consists of a incentive program, an incentive that is given to the participants on a monthly basis each of the 6 months. That incentive is based on their household size. They get $40 each month for themselves, and then there's an additional $20 for each person in their household. And so they go to one of the 24 now Balls food stores to spend that incentive. And we're trying to, for the future, we're trying to figure out how do we extend that to a lot more different locations. How do we make that easier for other retailers to take that incentive? The second piece is nutrition education. We currently offer in-person nutrition education classes once per month, and we also push out a lot of our nutrition education via text messaging and videos, and also on our website. So we try to get it out as many ways as we possibly can. We've translated our materials into Spanish, Arabic, Vietnamese, and Somali so that we can accommodate as many folks as we possibly can. So yeah, we're in 2026, we're still going to be planning on offering 1 cohort for 6 months. Starting in the program starts in April and goes through October. And then in 2027, we're really hoping to ramp that up to 3 cohorts in a year, which would be about 80 people per cohort, roughly 240 people total. And we're hoping to move away from getting the clinics to refer people to us directly, and make it more of something that a person themselves can say, hey, I fit those eligibility requirements. I'm going to have my doctor fill out a form that allows me to participate in this program. And so it really would open up the program to a lot more people, I think. So that's kind of our hopes and dreams.
Any questions? Online or in person? This is obviously a very a topic that is a lot of interest. It's a very timely topic. It always seems to be timely, though, unfortunately. And we've taken, it's already 11 o'clock. So maybe I'll let the panel, if there's anything you want to say in closing, things that you're trying to want to bring to people's attention for 2026, feel free to do that, or any other just kind of closing remarks as we end this part of our program.
I want to thank everyone in the room because this obviously is important to you and your organization. And I said, we are not the resource, but we want to be a resource of information. So if there's anybody, that is looking for more partnerships, locations, please reach out to me.
One just final piece I'll say about the Double Up Food Bucks in these convenience stores model. One of the reasons why I it hasn't happened yet is because many of these stores don't sell produce. Or if they do, it's very, very small quantities. It's a bunch of bananas or whatnot. Typically, the SNAP purchases that are being made are going to be more dry goods, other things that are SNAP eligible. So in addition to hopefully coming up with this sacred or holy grail of a solution, we have to make produce more available and across the country and across the city so that the Double Up Food Bucks can be relevant at all of these other locations. And we'll hope that that's a two-pronged model that as Canby's continues to expand, it opens up and makes more locations even eligible for this solution as well.
Thank all of you for being here and supporting what we do. I think collectively we can continue to push forward. We're looking forward to phase 2 of food pharmacy starting probably in February. So if any of you, if there's any additional information you need, feel free to reach out to me. If there's a clientele that you think would be suitable for food pharmacy, reach out, please. Also in 2026, we're piloting a cooking demo classes for the community. And so that would consist of, I'm not really sure how many weeks of cooking classes it would be, maybe 4, a series of 4. We'll have a chef, hoping to have a community chef, someone that's in the community that will be actually doing the education. And I think it's going to be small classes, no more than about 10. But that's something new that we're hoping to really push out the beginning of the year. And, as it relates to nutrition and nourishment and fresh food, we all deserve to have access to fresh fruits and vegetables and just good nourishing food. And many people still don't have that in our community, and they still, a lot of their food choices are based on affordability, maybe a lack of education. So we all have a due diligence to really continue to ensure that, because in most families are children, right? And so just think about, being able to help those kids, first of all, have food to eat so that they can go to school and learn, and to be able to, help those children, have earlier lifestyle changes to maybe start decreasing the amount of chronic disease that we're seeing across the board. So thank you for your support.
Okay, so I was thinking goes nicely with what you just said, and I was reflecting on what Tila's story about the washer and dryer, and just thinking about how we all in this room probably have some level of influence or power over the groups that we work with, whether it's in our organization, our church family, or even just our family. And so just remembering that and thinking about what's one action that I can take today or this week or this month that can help to increase access to healthy lifestyles for our Kansas City area, because it's going to take all of us for sure to get the work done.
And Donna?
Yeah, so I guess the final thing I would say is that it's very clear we have amazing resources and amazing programs going on. I mean, just the folks sitting in the room, just like there's so much that we have as foundational work, but there's still much to be done. So I just look forward to to continuing our collaborative work together and tackling what we can in our own community, and also trying to be a voice for, turning things around and trying to get to a situation where we don't have to talk about the struggles of eating healthy food anymore, but that it's something that we just do as citizens. So let's get busy to that.
Right.
Thanks.
All right, thank you. Everyone, let's give another applause for our panel. Just a few quick updates before we end for the day. Let me Okay. So just a couple quick updates, and be thinking about if you or your organization has updates you want to share with the group. Now will be the time to do it. We'll start with some of the things we've got going within the KC HLC. First thing I want to do is to acknowledge the very hard work of Kelly, Natalie, and Katie in all of the work regarding the KCHLC and the KC Physical Activity Plan. We have estimated that somewhere we've hosted around 75 meetings in 2025 just for the Kansas City Physical Activity Plan and the KCHLC. And that's not including the additional meetings we've hosted for the CDC REACH program. We're well over 100 meetings hosted between all of those things. So it's a lot of work. So thank you to the team for all your work on this. Yes, yeah, pretty good plug. Just a couple upcoming meetings for the Kansas City Physical Activity Plan. You can see these here. Public health, schools, sport is meeting in about 52 minutes. You can hop on there if you're interested. And business and industry is in January. If you're interested in any of those meetings, you can go to our website, kcphysicalactivityplan.org. And click on the Join Us tab, and that has the calendar and all the meeting information. Couple of things that we want to specifically highlight, and maybe I'll have Kelly give this particular update for the early childhood sector.
Hey everyone, just a quick update. We're really excited. The early childhood sector is planning a workshop, a training that has passed through the sector. We officially have a date, Saturday, May 2nd. It will be around gardening in ECE settings and the benefits of those. It will be here at Kaufman, and then we're going to do a workshop portion at the Discovery Center. If you want to join that sector, our next meeting will be on Monday, December 15th at 9 a.m. So. Okay, so our next update is on the Parks and Recreation sector. So we won't meet again until January 21st, but we actually do have a guest speaker for this meeting. It's going to be a two-part series. So January will be the first meeting, February will be the second. Caitlin Brody, she's a government affairs specialist with the National Parks and Recreation Association, and she'll be speaking on the different federal funding opportunities available. If you want to learn more about what that is coming up and looking like, you can actually visit our KCPA plan website. I'll have more information posted. The next update is on our it's actually our healthcare sector and our business and industry sector. We have been, for the last few years, hosting a Just Walk program. Well, recently the business and industry sector was approved for an implementation application, and partnering with the healthcare sector, they have decided to fund a third location through Children's Mercy because we've been very involved with Just Walk. So those walks just started recently. It's our Broadway location. These are open to employees and community members. I'm trying to go fast on this, I apologize, but if you'd like to learn more, I'd be happy to talk about it. Natalie?
We should chime in too. This is kind of on a sad note, but last month was World Remembrance Day for traffic victims. And there were a couple events in Kansas City. We hosted one at the chapel at Children's Mercy, and then Bike Walk KC hosted one down the steps of City Hall. I think they had about 40 people at the one at City Hall, and we had a good showing at the Children's Mercy one at all. They were particularly heavy this year because we've had a series of victims in Kansas City. 2 children lost their lives in October. And that stat on the top was just released by MoDOT, apparently statewide. Last year was the deadliest year for pedestrians, and this year we're far exceeding that. This time last year, we're 22% increase. So it's still a real concern. And the call to action locally would be, as they're doing the budget right now, Vision Zero is kind of talking about being on the chopping block. So it's really important that you reach out to your local elected officials right now and support Vision Zero, which is a task force that's looking to eliminate these traffic losses that we're experiencing in Kansas City.
Yeah. Yes, thanks for all those updates. Please contact your elected officials. Vision Zero supports things like road diets and safer sidewalks, and especially some of those things that we're seeing around schools that are starting to pop up where, our youngest are particularly vulnerable to traffic violence. So, yeah.
Can you send out some information on the Vision Zero?
Yes, absolutely. The question was sharing about Vision Share. Yes, we'll send some things out. Yes, it's very powerful, especially when, we had a family of a family who their son died, was hit by a car just a month earlier, and talking to those families definitely makes you want to do more. So, are there other partner updates that people would like to share with the group, things that they've got happening that they want other people to know about? I know you all are doing great work.
Thank you. Hi, everybody. Ed Kramer with UMKC School of Medicine and PA program. I just want to point out the work being done at the School of Medicine and PA program for initiating the curriculum for lifestyle medicine. And with us today is Sarah Cox, who's a PA faculty who is already incorporating lifestyle medicine into the curriculum, and Dr. Katie Miner, who joined a few of us last night for a lifestyle medicine interest group at the School of Medicine panel discussion on that. So we're kind of moving forward in that area.
That's amazing work. We've been trying to chip away at this for a decade now, and this is really important because as we train new doctors into lifestyle medicine, then they spread the message as they enter their own practice. So excellent work. And it can be really hard in big institutions that have operated a certain way for a long time to get them to change. So kudos to all of you. Any other updates? Hey. Yeah. Spring Corporate Challenge is doing great things. They're expanding. Not only do they just operate in the summer now, they offer fall and spring opportunities to be involved. So please, I guess, go to the Corporate Challenge website if you are interested. Any other updates? If you ever have updates that you want to share, we send out a monthly newsletter to all of our members. We've got 1,200 people on our distribution list, and we're happy to spread the word for your events. And we can also send out more targeted messages to places like, say, early childhood centers, if you particularly want to know address. Okay. Thank you so much for joining us today. Hope you all have a very happy holidays. We'll see you in 2026. Our next quarterly meeting has not been scheduled yet, but it will fall at some time in March of 2026. Thank you all. Have a great rest of your day and week. Great job, Gina.
Early for us, old time for her. huh?
Now, I have not seen any pictures. Have you seen any pictures or anything?
Yeah, I'll show you one.
Oh, okay.
It is on our website.
That's the back. Oh.
She's got two babies. Oh, my gosh. You know, they give me what you were, that's the one in the hand, and,
You know,
yeah, it's fun.
yeah, like now.
Yeah.
Yeah, no.
You.
No, I mean, so have that. They So, yeah.
I don't know where my photos are. Oh, we even, just to show you our excitement. Okay. Oh, there. So we had our.
Name drop. That helps at all.
See, that's what.
One's in New York and one's in Ireland. You're in New York and I'm trying to figure out. There. Yeah.
See, I'm not changing the view if it works. I doubt it if we already exited off. I was gonna say. There was. So, I was gonna see if there was a way to make the view full screen, because this was the problem during.
You see the other people?
Well, yeah, you could see them and then all of the teams.
Yeah, yeah.
So we didn't have this problem earlier. We got together and spaced it like almost 2 hours going through all the text.
Yeah, yeah.
So,
Well, like in Zoom, you click on like the people tab or something and it goes away or something like that. Yeah.
navigate, I feel like, than teams.
Some things are for sure. Some things I like Teams better for, other things Zoom is